Good afternoon and welcome to Webinar Wednesday. Today we are joined by Edward Myers, Director of Cybersecurity at Crothall Healthcare, Luke Smith, Senior Director of Solution Engineering at Asimily, and Peter Hancock, VP of Channel Sales and Strategic Partnerships at Asimily. Webinar Wednesday, we'd like to thank our sponsor, Crothall Healthcare. Crothall Healthcare provides hospitals and health systems customized healthcare technology management solutions, delivering more than a break-fix approach to medical equipment asset management. Their Healthcare Technology Solutions division provides the complete cycle of care for your medical equipment, ensuring original equipment manufacturer quality service and performance across all your medical devices delivered through the lens of a vendor-neutral solution. Through Crothall's partnership with Asimily, they bring their clients laser-sharp visibility into their connected medical device profiles, assess risk, prioritize actions, and develop mitigation strategies to reduce security vulnerabilities through state-of-the-art machine learning. For more information, please visit crothall.com. Just a quick reminder to save the date for our 2024 Spring MD Expo. We're headed to the M Resort Spa Casino in Las Vegas from April the 7th to 9th. So please join us for 3 days of education, networking, and the latest advances in medical technology products and services. For more details, please visit mdexposhow.com. Okay, and just in its continued effort to recognise the men and women in the HTM industry, TechNation magazine has introduced the Tech Choice Awards, also known as the Wrenches. Nominations in a variety of categories are being accepted through this Friday, November the 3rd, and up to 13 wrenches will be awarded, with the winners selected based on 100% votes from those who make up the HTM industry. The winners will be announced in the March 2024 issue of TechNation, so please don't miss out and get your nominations in by Friday. More details can be found in the handout section of your dashboard and online at OneTechNation/Tech Choice Awards. Today's webinar is eligible for 1 CE credit from the ACI, and you can obtain your CE certificate by completing the post-webinar survey, which will be emailed 1 hour after the completion of today's webinar. Now, you must complete the survey to receive your 1 CE credit, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. Let's kick off today's webinar by giving away one of our great Webinar Wednesday t-shirts to the attendee that can tell me the answer to the following trivia question. November is No Shave Month. Which rock band is famous for their long beards? Answer now using the questions feature on your dashboard, and I'll reveal the answer at the end of the webinar. We'll wrap up today's presentation with a live Q&A, so please submit your questions anytime using the questions feature on the webinar dashboard. As I mentioned earlier, our presenters today are Edward Myers, Luke Smith, and Peter Hancock, and they will be discussing addressing the expanded IoMT attack surface. Peter, you may begin whenever you're ready.
Thank you very much. Am I allowed to guess on the trivia contest or no? I don't want to ruin the surprise.
I know the answer.
And actually, we'll pay a nice compliment to TechNation. Eddie and I were at MD Expo in Orlando this week, and it was just a phenomenal show. Great networking, great session. So any of those that are thinking of going to the next one, I'd highly endorse it. It was very valuable for myself, and I think Eddie, you and I had a great experience there. So my name is Peter Hancock. I'm responsible for our global partnerships at Asimily. And today I'm very, very pleased to see our partner Crothall joining us today with our friend of pre-sales engineering, Luke Smith. So Eddie Myers, as he's known, has been in the medical device security world for over a decade. He's involved with the Healthcare Sector Coordinating Council, and he is a certified CEBT and HCISSP. Luke Smith has been in healthcare and security for almost 30 years. He's spent the last 3 years at Asimily, and he's consulted with thousands of healthcare customers around the world focused on medical device security. And you may ask yourself, so why IoT? Why this session today? And an article that we all just saw come out across the wire, very timely in the last probably 24 hours or so, is to say that within healthcare itself, what we're seeing is that we are really kind of changing from what we know now today within IoT, around a $41.5 billion market. That's going to grow in 2028 to 166.5 billion based on estimates. That's a CAGR growth of 32% increase over the next few years. So as we think about all those devices that are attached to humans and patients and hospital beds and all the different elements that sit within a hospital, whether it's the elevators, the heating and ventilation system, the badge access, all the pieces that sit really within a hospital and the kind of circumference of that hospital to make it secure. So it is in the best position possible for a patient to be received in and to be cared for. That is what we do, and that's why we exist today. We exist to make sure that patient care is first and that safe patient care is first. So if we could go to the next slide. What we're going to do today is talk about these trends that we see, both Luke and Eddie from their two sides of the world. Eddie seeing it from everything around HTM, and Luke seeing it from what I hear every day is not, I've seen one of these, I've seen thousands of these, millions of these. So if you ever want to know how you can break into or make a infusion pump vulnerable, ask Luke Smith. We also are going to look at why inventory is not enough. We've had over the past few years a small select number of vendors, as well as a lot of manual process around how do I go out in inventory. And for all of us, we know inventory is a very manual process. There is a way to automate that. And for all of you who are printing off MDS2s and checking the boxes, there's a way to digitize an MDS2. But why we say inventory is not enough. It's good to know that you've got all these books in your library, but if you've never read them, you don't get any wiser. Or if you know that you've got to actually go into that garage and kind of clean it out because there's some rubbish in there, you actually have to go do that work. But what we want to make sure of is you're doing the right work. So as you get your inventory and you understand where you have vulnerabilities and exploits, is that something that's actually going to be exploitable? Is that something that you actually see as a cybersecurity risk? So we're going to dive deep into that. We're going to go into the analytics of how we drive and mitigate risk, and then really how do you bring in partners to help you manage a program like this? Because if you can imagine at your hospitals or your healthcare systems, there's not thousands of these devices, there's hundreds of thousands of these devices. And now with the number I just shared, that's going to get even bigger. At MD Expo this week, we actually had a question in the audience that said, is there ever thought that manufacturers might release less of these devices over the years? And the answer is no. It's just going to proliferate even more and more and more, especially as we start seeing the 5G networks come online. So with all that, there's a lot to discuss here. So gentlemen, let's get started.
So thanks, Peter. I want to first start off by talking about trends and challenges that we're seeing as emerging in the industry. These are critical, and I'll touch on a couple. I'll ask Eddie to touch on his favorites as well. A couple of things that I want to draw your attention to. One is right now, just a couple of things. One, the $10 million is the average cost per incident or attack, right? A good portion of that cost is going to be the cleanup and remediation once an attack has taken place. So there's a lot of cost. So imagine that all the devices in your network, you don't know which ones are compromised, which ones need to be rebuilt or reinstalled. There's a huge amount of effort that goes into the remediation of that. And in my opinion, $10 million is probably low. The other thing that we're seeing, and I remember when we first started seeing mortality as a result of a cyber attack. Today, that is increasing. You'll see in the upper right-hand corner there, 20% increase year over year of mortality as a result of a cyber attack. So long gone are the days where this is theoretical, that it's, there's still like some people out there saying it's not happened to me, it's not my issue. This is a real issue that all of us have to address, and is becoming a greater issue as we move on. And then the other thing that I'll point out, really just looking at the bottom right there, or the breached by third party. So almost 50% of these are as the direct result of third-party breach, meaning the breach came through a vendor supplier supply chain issue. So we want to talk about how do we secure all of these things? How do we plug these holes? Eddie, I know you run into a lot of this stuff yourself. What do you see are the key metrics here that you're really concerned about?
Yeah, absolutely. Thank you, Luke. So some of the ones that stick out to me is the top left, 43 attacks per year. I remember when I first started in cybersecurity, it was very hard to get the ear of the CIO and the CISO because at the time there really had not been breaches, there had not been attacks, and now with it increasing, these attacks have impacted my friends and families with hospitals close to where we live that have been brought down that have prevented cancer treatment on time. So people really are starting to understand this, and it's getting the visibility that it needs to. Another big one for the HTM community, everybody on here, we extend the useful life of medical devices. And so, 40% of devices are end of life. So having a solution like Asimily in place to where you can continue to, extend the useful life, not only for service, but for cybersecurity. Just because it's running a legacy OS doesn't mean it needs to be replaced, and you can continue to keep it secure. And then, the bottom right, 50% caused by lack of talent. Just the lack of awareness of what a technician or a person is doing on a medical device, and then also lack of talent responding. Having a managed service program in place to help secure these devices, and filling that void. So those are the ones that really stick out to me.
Yeah, I'm gonna
jump in here for a second. I'll go back to that slide, Robert, for a second. The mortality rate. We were actually with Crothall a few weeks ago when we were talking about the stat. At the same conference we just discussed at MD Expo, that stat actually said 21% for a completely different source. So we are seeing consistency across that. Mm-hmm. And I think a hard thing for everyone in this business, especially in cyber, is we don't like to talk about how we protect ourselves. We don't like to talk about the tools we use, because then we tip our hand to the threat actors. But if for those that are saying that this couldn't happen to me or it doesn't happen, the Office for Civil Rights under the Department of Health and Human Services has a public website that does publish and publishes daily those breaches that are reported, because it is regulated that you have to report if an incident like this does occur. So for all of those that are saying, I want to learn more, or is there a site out there that says who has this happened to, and is it possible? It is the Office for Civil Rights, Department of Human Services breach report. So just a little tidbit there as well.
Yeah, great point, Peter. Thanks for that. So when we talk about the ever expanding attack surface, obviously, what we're looking at is a large number of devices getting connected. Right now, what we're seeing, Asimily worldwide, we have operations worldwide. It does vary by region. In the US, I would say typically we're seeing about 20 to 30% of the total number of medical devices an organization owns are connected. What that kind of translates, this study translated that into what does that look like per hospital room, and it's roughly around 15 to 20 connected devices per room. And what we're seeing is, many studies say this number should double or triple. We're seeing 60 to 70% within the next few years. So again, we're seeing a large number of devices that are being connected to the network on a continual basis. And the real struggle is, are those just bombs waiting to go off that we're plugging into the network on a regular basis, or are we properly securing them? How should that work? What does that look like? How do I deal with the expanding attack surface? And that's what I really want to deal with next. Now, Eddie, do you want to cover some of these? You want me to cover them? How do you want to go about it?
Yeah, I'll jump in on the first three. So, with some of the challenges having that visibility into the network. So before, we partnered with Asimily, it was an extremely manual process. That was a technician going to each device, getting into the, settings, collecting the information that's needed, bringing that back, putting it into the CMMS. But, now with technology and Asimily, we're able to automate those processes to where we have visibility that we've never had before into our medical devices. And then once that's collected, the next major hurdle is, okay, where do we start? What's the most important? And through, vulnerability management with Asimily, we have a definitive starting point so that we can take action very quickly and make an impact right away. And, obviously as we do this, measuring where the risk was and where we are today is paramount to, showing our clients what we have done and how much more secure and how much we've reduced their footprint for vulnerabilities. And it proves extremely valuable for the CISOs and the CIOs at our client sites.
Yeah, I couldn't agree more, Eddie. One of the things that we see is that a lot of times the tools that we choose to use, especially around prioritizing I can't say the word, prioritizing the work to be done, is difficult. They give us a huge amount of data. I see a giant list of vulnerabilities. What do I even do with that? And it's really struggling to find out what do I work on first? How do I actually reduce the risk? And that's what's a real struggle. And then when we talk about number 4, incident response, this is an interesting one because I often will ask when I consult with HDOs, I often ask, do you have, first off, are you sending threat analytics, intrusion detection, intrusion prevention, anomaly detection, threat intel? Are you sending that to a SIM or a SOC tool? Does your SOC receive alerts for medical devices? And then I'll ask, do you have an incident response process? And the answer invariably is yes, of course we have. Then the next question is, great, does that specifically take into account medical devices? And then it's usually, what do you mean by that? And so when we look at incident response and talk about, for those of you that may not be familiar, what is that? Why do I care? When we're talking about threats or risk in an environment, those are two different things. I always kind of liken this to, you've got a house, and if someone does an assessment of your risk and threats to your house, vulnerabilities are about risk. It's about you've got a window on your back wall that has no locks on it. Attacker could get in through that way. You might say that, your lock is outdated on the front door, or someone could break it. So these are really identifying potential ways that an attacker can attack your home. That is not to say that an attacker is crawling in through the back window because there are no locks on it. That would be a threat. That would be an active incident. So when we talk about incident response, we're talking about, how do I respond to somebody attacking me at this moment in time? And the keys to that are having good data. I need to be able to collect forensic analysis data. We're going to dive deeper in on this, but in most cases, most organizations don't have a process. They don't have tools to be able to collect that, and therefore they are struggling. It's not an if, it's a when they're attacked. They're flat-footed. They're not able to respond. They can't get to the root cause. They struggle to actually repel an attacker. And as a result, they're left picking up the pieces after something like ransomware has happened. So these are all key things that we really see are critical. And then the last one here, near and dear to my heart, third-party risks are concerning. We have only to go common spirits. There are so many attacks right now that we can point to third parties being involved in that. How do I secure the vendors that have access to my devices and that have access to my network? We want to look at all of those things and how do we address those? Now, how should this work? What I often want to focus on is, I don't want to spend all my time focusing on all of the stuff we're doing wrong. I want to focus on, what should this look like? What does good look like? If you're going to do this right, what does that look like? So let's drill in on that. We're going to address this from 6 different easy steps. And that, first and foremost, is complete visibility. It is ridiculously difficult to protect a device if you don't know what it is, or you don't know that you own it. And this is back to what Eddie was talking about earlier around visibility. I need to have a tool that can detect everything in my environment for me. Next, I need to understand what my risk is. This is going back to, don't just give me or use tools that give me a giant list of vulnerabilities. What do you even do with that? So often what we have is too much data and not enough actionability. We're not able to take steps to reduce that risk. The third piece here that we really need to focus on is a maturity piece. I want to ask you about your organization. How are you collaborating for remediation and success? Are there teams set up, cross-departmental functional teams that are, have purview over things like information security, network engineering, HTM? Are you pulling those groups together and enabling a successful work effort across those different functional groups? We're going to dig in on that. And then how do you protect against real-time threats? Are you able to respond? It's, again, a when, not an if, someone's going to attack you. Another key piece here is managing across the life cycle. In most cases, what I see when I consult, people are simply connecting devices to their network. In most cases, nobody even knows that's happening. We just have devices that show up, and we're not properly assessing risk before we connect the device, managing that device from procurement all the way to decommissioning. I want to talk about some key practices in there about how you can manage across the life cycle. And then lastly, of course, is leveraging vendors. We're seeing a huge lack in skill sets, in experience, in tool sets. And what we really have come to the conclusion of is there are great vendors out there that can help you bridge those gaps. You should be engaging one. So let's dig in and talk about it. So the first step that I want to talk about is moving beyond inventory. Many of you may own a CMMS tool today. The question I would ask is, how accurate is that CMMS? Does it have the data in it that's necessary for you to be able to assess risk and do the things that you need to do? Is it complete? In most cases, the answer to that is going to be no. What I need is tools that are going to help me to accurately classify. So when you look at the classification, traditional IT tools that we might be using don't properly classify medical and IoT devices. You get this giant bucket that's just unknown. Even when you're looking at tools that are purpose-built for this, many of them have some limitations. Many of them only use certain functions for discovery, such as they will only do deep packet inspection. So when you look at this, the tools that, like Asimily, that will go out and create an inventory for you, they are primarily doing that through two models. One is deep packet inspection. This is where we actually are looking at the traffic of that device as it traverses your network. We're pulling that data apart. We're inspecting the protocols. We're looking at all the data contained in those packets and picking out the pieces of data that we want. The other common methodology is AI, using things like machine learning, which there are some vendors out there that do, but there are, again, advancements. Newer tools are using not just machine learning, but natural language processing, which enables it to understand the English or whatever data, that the words that are contained in that packet itself. Now, why are those two differentiations important? When you look at tools that just do DPI, what happens is if they haven't seen enough data to properly classify a device, they don't show you the device. So that means that you've got devices in your network at this moment in time that you don't know anything about. This can create what's called a shadow IT problem. I have devices that could exist in a network for weeks, if not months, before they have received enough data to be properly classified. So that's a huge deal. We need to be able to see devices the moment they're plugged in, and in order to do that, you need to incorporate different models and methods of discovery. So that's kind of a tip, a trick. When you're looking at tools and looking at these things are things that are going to help you in the long run. The other thing is we need to get beyond the basics of just providing the standard attributes for a device. Any tool out there that does this can give you things like the IP and the MAC, the host name and the OS. Those are basic attributes. We need to understand clearly, what is this device connected to? What is it communicating with? Who communicates with that device? We need to clearly understand all the connections across all the device types with all of the attributes. If I have a device that's on a regular basis communicating with China, I want to know that. That shouldn't be happening. And those sorts of things, again, not every tool or not every inventory solution out there is going to solve. So these are key pieces that we need to keep in mind. Eddie, did you have anything that I missed that you want to chime in on?
No, I mean, just getting that extra information. One of our big hurdles is whenever a vulnerability is released, knowing the exact software revision, the exact operating system that it's impacted. And if you don't have that, again, it's sneaker net, it's running around, it's pulling an inventory and trying to do that. So getting that information automated and pulled into the CMMS for quick validation is just paramount. We all know in a time of crisis or a breach, time is of the essence. And so every second counts. And with that information, we're able to respond quicker.
Really good point. So let's understand attack paths. So this can get a little technical. I'm going to do my best to explain it to everybody that might be on the call. When we look at how tools assess risk, so we're talking about CVEs, or common vulnerabilities and exposures. These, again, are the disclosed risks that are with a particular device. When we look at the methodology that people tend to go about solving those, there are two common methods that we see out there today. One is patching, and the other is segmentation. And both of these are absolutely viable methodologies. They do have, of course, some limitations. First off, when we talk about patching, so as I'm sure many of you might be aware, just because I have a vulnerability does not mean that that vulnerability is actually attackable or exploitable by an attacker for that device in your network at this moment in time. So there's a lot of things that go into, can an attacker actually take advantage of that vulnerability and attack it and exploit it? And I'm going to talk about exploitability, meaning it can be exploited. And there's really kind of two models that we look at. One is public exploitability. There are tools out there that will tell you that information. Asimily is one of them. And public exploitability is, has somebody exploited that vulnerability in the wild at some point in time? It's a key indicator of risk, and it's one factor we want to take into account in the risk assessment. But more importantly, what I care about is, can an attacker exploit that device in your network? Because just because I have that vulnerability doesn't mean the attacker can actually attack it. And that's what gets us to false positives. So anytime we look at vulnerabilities, we are going to look at a certain number of those. Typically in most tools are going to be false positives. They don't actually apply. They're not actually attackable. So what we want to be able to do is clearly see, what can an attacker do? I need to weed through all of the sheer amount of information I collect on vulnerabilities to get down to, what can an attacker actually do in my environment? Because most organizations do not have unlimited resources. They need to focus what resources they have on what an attacker can actually do. Now, this leads us to understanding an attack path. An attack path is simply, what is the path an attacker must take to compromise that device for a given vulnerability? What Asimily does that's unique in the industry is we actually look at an attack analysis based on the MITRE attack framework to identify, not just is the device vulnerable, but how can an attacker attack it? What that then enables me to do is to follow this process that you see right here. And that is, if there's a patch available, let's apply the patch. That's the easy step. That costs the least in the organization. It's the simplest to execute, and it is easy to apply. If there's not a patch, and I'm going to tell you, the vast majority of these things cannot be patched. I wish it were different, but that's the world we live in. I know I meet a lot of IS people that go, look, it's running Windows XP. Why can't you patch it? It doesn't really work that way. Just because Windows has a patch for it doesn't mean I can apply it. The medical device manufacturer must approve that patch. It's typically going to be, combined into a software release that I can then purchase and then apply. So struggle here, and in most cases, you're not going to be able to patch these. It's not always going to be a viable option. But what I want to do is I want to apply the lowest cost, easiest method to mitigate risk first. I don't want to jump straight to segmentation. Segmentation, really quick, for those that are not familiar. Segmentation is where I'm going to take that device, I'm going to isolate it from other devices, and I'm going to restrict what it can talk to and what protocols and services it can use to communicate. Now, segmentation, a very viable solution for solving a lot of problems. There's a lot of confusion around segmentation. Segmentation, sometimes referred to as zero trust sec or zero trust security, is kind of seen in many cases to be the panacea to all my woes. It's a great tool in the toolbox. Is it the only tool in the toolbox? Far, far from it. I need to apply the lowest cost solution first, and the lowest cost is typically patching. If I can't apply a patch, I then want to look at how can that device be attacked. I want to mitigate the attack point. So if a device can be attacked or exploited over, say, the remote desktop protocol or over like an SNMP protocol, I want to block that protocol if it's not in use and remove it so that then the device cannot be attacked. So that's a method of segmentation that's called targeted segmentation. So when we talk about segmentation, you got targeted, macro, and micro. Micro being the hardest, then macro, then targeted. Targeted is the easiest. So we want the concept here is to apply the lowest cost, fastest remediation method possible. Any sort of assessment that's done for this should incorporate manufacturer documentation like MDS2s, software bill of materials, should incorporate an advanced network analysis. That MITRE ATT&CK framework is really common, but this is really about understanding how that device can be attacked and then applying that lowest cost solution. All right, let's move on. Eddie, I think, why don't you take this one? I think it's a one that's probably right up your bailiwick.
Yeah, absolutely. So, we talk about, implementing tools, like Asimily, but to make the program successful, you have to have collaboration. If you do not have that collaboration, the program's going to fall apart. And, that means bringing in the HTM team. That means bringing in information security, network engineering, and vendors, because once you have that, as Luke just talked about, patching. A couple examples come to mind. I remember when Bluekeep came out years ago. It took some of the manufacturers a year to validate the patch and push it out. When the Log4j, when that came out, we were ahead of the game because we then had Asimily. We were able to put in the tripwires. We were able to close ports and do that. And so the reason why I bring that up is having a committee, having monthly meetings where you have information security, network engineering, you're able then to, sit down and say, okay, look, we actually have a patch for this device. Are we approved to put it on there from the health, from the client perspective? Secondly, you know what? There's no patch. There's potentially no mitigating steps. We need to look at segmentation. Again, that's the last ditch effort, but then you have network engineering on there. Okay, yes, we can do that. This is how we'll do it. And, having all that together will elevate that program. And then, again, leveraging your vendors. A lot of the time it takes the hospital going to vendors saying, hey, look, we're thinking about, replacing our fleet of CTs. We're having some problems with you and getting some patches and getting some answers around, mitigating steps. And so being able to bring that to the hospital and having that collaboration, because, quite honestly, there kind of is still that gray area between HTM and IT. And if it's going to be successful, if the program is going to move forward, bridging that gap, letting each side know that you're on each other's team will really help with that. And one of the things that is not on here but needs to be brought up is whenever you have technology like Asimily, also having them involved in those committees is paramount, because as you're going through this, and this is what Asimily is great with, as you're going through these, there are questions that come up, and sometimes you don't have time to wait. And so having that vendor on the call in that partnership will only again help push forward the program.
Yeah, such a great point, Eddie, you bring up. It's really about creating a functional working process across those disparate groups. And that's when I assess an organization for their level of maturity and I'm going to consult with them. These are common questions that I'm going to ask. How does this work for your organization? Because it's going to tell me how successful you can be. If you have a process in place and you can get all the right people in the room and make those decisions quickly and implement change quickly, proper change process, those are all critical success factors for sure. So let's move on and talk about threat detection and integrated response. So part of the goal here is I'm trying to help people to realize that it's not an if. We still have this mentality that, I've not been hacked, I'm okay, everything's good in my site. I've literally heard healthcare professionals tell me, I don't know that I want a tool because then I'm going to know. I'm going to know all the stuff that I'm messing up and I've got to do something about it. Ostrich mentality and burying our heads in the sand is not solving anybody's problem. It's not going to go away. It's not going to get better. I can't encourage you guys enough to say, address this with your senior leadership. This problem is not going away. And sadly, in some cases, I've literally seen where they have to be breached before they wake up and go, okay, I guess we got to change things. So when we talk about this, and I'm sure Eddie, you and I could just sit here and tell horror stories, but let's not do that.
Yeah. I mean, I've
I know,
talked
I
to
saw it in
CISO
your mind.
saying,
I can tell you stories.
CISO saying, hey, it's built in our budget, we'll risk it. And that's not the mentality, because and the first thing I tell them is, does your family not go to the hospital you work at? Are you willing to risk your family? And
20%
that
increase
usually
in
resonates.
mortality, 20% increase.
Yeah,
exactly. And so this is a big problem. And part of the struggle here, I think, is that people look at these attackers as it's some bad guy living in a basement in Iran. They have no real concept of who these people are. These people have day jobs. They have health insurance. They go to an office building. This is their job. Their job is to breach your facility and to extract money from you. This is all about money. It has nothing to do with people. It is solely greed. It's about money. And so the struggle here is to understand that it's a business. And that's that. So realistically, what this comes down to is your ability to detect those threats as they occur and then respond to them. And how well you're going to reduce the risk in your environment is going to reduce your likelihood of getting a threat, actually realizing that threat and that attack. So first off is reduce that risk, lower that threat percentage. Next, its ability to detect those threats and respond. So let's dig in on that. We want to be able to, and the key concepts, minimize incidents. These are cyber attack incidents, accelerate our ability to investigate and get to root cause analysis, and recover rapidly. So this is to understand and having a tool that can detect zero-day attacks like Log4j. When Log4j came out, Asimily had the ability to detect that and remediate it within, I think it was 6 hours or something, Eddie. It was really, really quick. We have a threat intel team. You want to partner with organizations that are going to provide that level of capability to you, that that are going to give you that ability to detect those things immediately. The next concept is block those threats, capture forensic data. Oftentimes when we look at threat intel, all it says is this happened on this device at this time. Okay, great. What do I do about that? Well, it's not happening right now. What even happened? I have this alert, but I have no ability to even figure out what even happened. And that's where we talk about forensic analysis. Forensic analysis is the capability to collect a detailed account of what took place. Most of the way that that is done is through packet capture. It's capturing the entire transaction, the network transaction that took place, or session that took place when that attack occurred. And then an incident response engineer can then pull that data apart, identify root cause. Was the device actually attacked? Who attacked it? Where did the attack originate? What type of attack was it? And again, then what do we need to do to mitigate or to remediate or mitigate that? So without a tool that has the ability to collect forensic analysis data, how does this work? Many organizations I consult with will tell you, I'll ask them, do you have an incident response retainer? And the answer is invariably yes. Does your incident response retainer, do they have the ability to collect forensic data? I have no idea. And again, we look at the IRR as like this panacea to all my woes. I pay somebody to go do that. Well, you call in the troops for an incident, what's the first question they're going to ask you? Do you have forensic data? If the answer is no, well, then they have no ability to protect your network. There's no magic in their ability to figure out what happened if you don't have the data collected already to be able to determine that. So the struggle then is, in many cases, an incident response team is solely doing cleanup. We're now, the ransomware is executed, it's over, you paid the money, you're moving on. You're trying to figure out, how do I remediate that? And that is, again, where you need a tool that can help identify it. I consulted with I make friends for a living, basically, but we had a customer, their leader of their HDM group left and went to work for another organization. That organization did not use a tool like Asimily, and as it just so happens, within 30 days of him joining that organization, they were ransomware was executed on them. It was a huge mess. They brought in an IR team. The team was like, no, we have no data. We're in a cleanup mode. They wanted to go out and install clients and agents on medical devices. You can't do that. So it was a huge mess. And we talk about weeks of time it takes to recover from these events. That's why it's taking weeks. A, nobody knows what happened. B, I don't even know what devices were compromised. How do I clean this up? It's a massive amount of effort. So this is, how do I take my team to the next level? How do I put these tools in place? These are all critical success factors for your organization to be successful in repelling an attack. And then, being able to continuously respond and improve upon that response. Eddie, any thoughts? I know you guys deal with this from time to time, but.
Yeah, no, absolutely. Packet capture is huge. Finding out exactly what happened, being able to go back and prevent that again, because you might have 10 or 15 like devices, and going back to prevent that from happening on those is definitely paramount.
Yep, exactly. And again, we're talking about how do we make this a reality where we can actually protect our environment and make it easy, right? It's got to be easy. So I want to talk next about key to success for medical device risk management, and that is managing across the life cycle. Many of you may not know that there is legislation from OCR and the Joint Commission around requirements for a risk assessment for medical devices. You should be assessing these devices before you connect them to your network. Again, I consult with organizations all over. I ask this question: do you do a pre-procurement risk assessment either before you've purchased a medical device or before you deployed it? And the answer is often, I don't know, do we do that? Or it's, oh yeah, we do that. Grant, what does that look like? Does that risk assessment result in the hardening of that device? The answer is, I don't think so. I think we just, like, Joe does this and it ends up in some file share somewhere, and we ticked the box, but we've not actually reduced the risk or made the organization better. And we're wasting time is what we're doing. And so when we look at this, we need to be managing across the life cycle. You should understand what the relative risk of a medical device is, preferably before you purchase it. So I need to understand, I want to make the best purchase decision I can. And oftentimes, again, just changing the OS that you're purchasing can have a significant impact on the software version can have significant impact on the risk of that device. Understanding that before I purchase enables me to lower risk as I purchase new devices, and over a period of time that can have a profound effect on the overall risk of an organization. Very few people do this. But when we're talking about how do we take an organization to the next level, how do we get manage the risk, most people are overwhelmed. Putting in a process in place to be able to manage risk before I connect the device means that I'm not having to go back around the connected device and clean it up. I'm not just constantly introducing new risk into the environment every time I connect one of these things. And that's if anybody knows you've connected it. I run into a lot of customers that are like, yeah, IS goes, yeah, we never know when they're connecting a new medical device. It just happens. So there's no process around this. And so much of this is about having a tool that you can then work a process around to facilitate that. So it should incorporate these things from pre-procurement to deployment to operations to disposition, decommissioning. That's the life cycle. We need to manage at every phase of the life cycle. I want to look at risk. I want to deploy that medical device in its lowest risk configuration possible. I want to deploy all of the similar medical devices. Let's say I've got a whole host of Epics, Epic 7Cs, or I've got a bunch of Logic E's out there, right? And what I routinely see is I'll see a list of Logic E's all with the same operating system with 5 different risk scores. Why do they have 5 different risk scores? They've all been deployed in different configurations. They're not all configured the same way. So these are key facets of helping me to manage. I should know what that hardened configuration looks like. I should see every single device, unless there's a documented exception, deployed in the same way. And so key to this is to have tools that enable you to do this within your organization. This is what gets you to good. Now, I want to drive a little deeper into this and talk about what should that risk assessment include and how should it be functional and valuable to your organization. So here what you'll see is, again, like combining all of these things together is what makes a great valuable risk assessment. The inputs to this should include things like manufacturer documentation, the MDS2s, the manufacturer disclosure statements for medical device security, the software bill of materials, the clinical workflow, how are you going to use it, understanding services and operators, how is the device going to be serviced. This is a key one to negotiate with your manufacturer. If they're providing services to you, how are they doing that? Are they doing it in a secure fashion? If not, you need to monitor that interaction, right? If you've got some medical device manufacturers going to remote into that device, they should be doing that in a secure fashion, right? So those are key concepts. That should be outlined in my deployment plan. I should understand how am I going to operate and deploy this device. And then having a deployment plan makes it so, or a configuration and control plan enables HTM to say that we're always going to deploy those Epic 7Cs in the same way all the time, right? Again, unless there's a documented exception. Outputs to this plan should include things like how is the device attackable? In virtually, in most cases, you're still going to have some risk with that device, right? In most cases, we're not removing every risk. That's not typically even possible. So I want to understand, well, what is still exploitable? What am I going to leave open? I want to document an exception for that. I want to understand how that device is hardened, that configuration plan, the documented exceptions, as I mentioned. And once I've done that, typically we're going to do this for a model of device. I'm not going to do it for every single medical device. I'm going to do it for all my Epic 7Cs, for all my Logic E9s, right? For all my whatevers, my BD, whatever device you've got. And so I'm going to do it by that model, and that becomes the Bible, if you will, around the security of that device. So these things enable me to be successful, and they enable. And when we talk about how you're going to make this a reality, these are common points of maturity that really move the security needle. Let's move on if we could. Eddie, I think you should cover this one. This is key for you guys.
Absolutely. So, all is great and well whenever you roll out technology like Asimily, but who's going to manage it? I spoke earlier about that gray area. Who's going to fill that gray area? Yes, IT understands all the IT aspects about the medical device, but we all know we don't want an IT person touching medical devices. And the majority of the HCM are not IT professionals. So, first is investment in resource and staffing and filling that gray area so that the amazing software is not just sitting there not being managed. In that, then having that program that manages it, having that collaboration that I spoke about earlier, allows everybody to focus on the core mission, allows that nurse to focus on patient care, allows that doctor to not have to worry about anything and provide the best care possible. Because again, our families are going to those same hospitals, and with the threats and the sophistication growing, having a partner that has a threat intel department that stays ahead of everything, that can relay it to a team that can quickly respond to it is, again, paramount to ensuring program success and, reducing the security footprint of medical devices.
Yeah, it's so critical, and what I've really seen from consulting is just the huge skills gap. I can't count the number of times where you have this conversation with the HTM team or IS, and they just don't really understand how this works for medical devices. That skills gap is a killer. And so this is a great way to leverage support for that skills gap, get the process and the organization off the ground and running and safe. So at this point in time, I think I will turn it back over to you for questions. Are there any questions that we can answer for you guys? We'd love to hear your feedback and answer any questions that we're able.
Great. Thank you so much, Luke. Yeah, we have got quite a few that have come in. I'll get through as many as I can. The first one is, what cybersecurity measures can service providers implement to protect patient data?
All right, Eddie, I'll let you take this one and I'll take a stab at it as well. So first off, understanding clearly what devices transmit or store protected health information in your network is step one. I can't protect patient data if I don't know where it is. And then step two is really around implementing these programs that we've discussed already. So understanding what the risk of those devices are, making sure that I have proper vendor controls in place. How is that vendor remoting in to ensure that we don't have any leaks where data is going to get out of my network and no one knows that that's going on. It's having proper controls in place. Are those devices hardened? I really talk a lot about how do you harden medical devices and really secure those devices. And that's everything from how am I securing their risk and reducing the risk for those devices? How am I analyzing threat attacks and threat intel to understand where they're being attacked? How do I defend them? All of those pieces go into protecting patient data. And at the end of it, it's from a big picture perspective, it's about instantiating these processes within your organization to ensure that you can mature, that you can grow, right? No one's going to solve this problem tomorrow. We didn't get here in a day. We're not going to get out of here in a day. But it's in making sure you've got a plan to grow this capability, leveraging your vendors and your partners to shore up your gaps. Those are all key pieces. Eddie, what did I miss?
And so, Luke talked about the technology and the processes. I'd like to touch on the people skills. Again, back to that gray area, upskilling the technicians, putting them through baseline IT training like IT fundamentals. Get a baseline IT understanding so that you're not intimidated whenever you go talk to the IT department or when the IT department comes to you. Be able to have that same vocabulary and understanding. That will also enable them, if you do have a managed service and the security operations center reaches out to them and says, we need you to do X, Y, and Z. Not only do they know how to do that, they know why they need to do it. And so with those two, that will help with success.
Yeah, and they're all speaking the same language, right? I mean,
That's a big part of it, right? So I grew up in cybersecurity, and as I've been relating to the healthcare world, I think there's few things that we all can do, and one of those you just hit on, Eddie, was like, how do I talk that language? So there are many courses out there, Coursera and others, where they offer cybersecurity awareness training, and I'm sure many of your companies also offer it up, and sometimes it may be a little too elementary, but for those of you that are taking a look and saying, this is really interesting, really compelling to me, I don't see it shrinking, it's only something that is going to expand my level of knowledge. Those cybersecurity awareness trainings that are online are a great asset. And then there's many of our alliance partners like a CrowdStrike and others that will offer training for free. There's a whole library of free training out there from the likes of CrowdStrike and others that would actually kind of give you an insight into what is all this kind of tech mean, and then how do I relate it back? Because one of the biggest challenges that a chief information security officer has is relating to the board that this could actually happen, and if it does happen, it's cost, and it's not just the extreme cost of some of the casinos that we saw and you've all seen in the news recently. It's what's the real cost to me and patient lives, and am I redirecting people from the ER, or am I shipping hospital beds out to my neighboring hospital because I'm now in a place where I don't have safe patient care? And those are all kind of aspects we have to think about.
Yeah. Reputation is another big one we've heard a lot about.
Yeah.
Great question. Any others?
Perfect. Right, we've got time for about one more, I think. What sources should I be monitoring to stay up to date on the latest threats to medical devices?
Mm-hmm. Yeah, great question. I can talk about a couple that I do. HISAC has got a great feed of threats. We can share that link to that. ICS Cert, another good one. NVD. There are a number of different places that you can get 0-day and threat attack specific data. Eddie, are there any that? Yeah, go on.
Yeah. Well, I mean, one of the ones I monitor is CISA. They did start in industrial controls, but they did see that there was a gap in healthcare, and I will say that they are extremely quick at releasing 0 days. So it's free to sign up, and again, that they put out the information extremely quick.
Yeah, another good source. Great question.
Yeah, Jen Easterly and that whole group does a fantastic job. The other one that I'd throw in there is HIPAA also does a great job at kind of covering the immediate threats and then the impact of those threats. So HIPAA has a great library of knowledge as well.
Yeah.
Perfect. Right, we've got time for one more question. In summary, what would you say are the main cyber threats facing the healthcare industry?
I think top of that list has got to be ransomware. And I think that's the one that's keeping everybody up at night.
Mine would be people. People, right. Potentially inappropriately, not in a malicious way, but checking email on medical devices, and so that's really what keeps me up at night is physical access control to sensitive medical devices that could potentially have access to the internet. One of the things I think about is hospitals are very good at blocking internet on their managed computers, but they're not blocking them on medical devices. And people in hospitals, will be able to find that, search the internet, do whatever they want, and so that's what keeps me up at night.
Yeah, that's a big one.
Yeah. I think what keeps me up at night is what I see happening on guest networks, the countries and the inappropriate websites that people are using either on guest network or as part of an actual browser that sits in the IoT device. So we see traffic from printers heading out to China or to India. So there's no reason, or should be no reason, why some of these devices are talking to nation state or foreign state. And then the other piece is just to Eddie's point of it maybe not malicious, maybe not thoughtful, but are those guest networks, because people will make mistakes. People will open up an email. We've all learned over the years not to do that, but people still do it. because the threat actors get more and more sophisticated. And I think if we go back to TJ Maxx, when TJ Maxx happened 10, 15 years ago, for those that don't remember, it was someone sitting outside the building, getting on their Wi-Fi and then getting on their network. So just not having all the compensating controls in place, and then really harden the guest network, because
we routinely see medical devices on a guest network. Somebody gets frustrated at how long it takes to get a device connected, and they just connect it to the Wi-Fi. That's a huge problem. So yeah, you're exactly correct.
Perfect. Thank you. Well, we've come to the end of our hour. So thank you so much, Eddie, Luke and Peter, for your time today and for a very informative presentation. I'd like to encourage everyone to visit today's sponsor to learn more about the services they provide to our industry. So please visit crothall.com. As promised, the answer to today's trivia question is ZZ Top. So congratulations to our winner, Stephen Ellerthorpe. Enjoy your t-shirt. And just a quick reminder to obtain your CE certificate by completing the post-webinar survey. And the survey will be emailed 1 hour after the completion of today's webinar. You must complete the survey to receive your 1 CE credit from the ACI, and you'll be able to download the certificate directly from your computer once the survey is submitted. If you have any questions, you can reach us at webinar@mdpublishing.com. We'll be back next week with another webinar, so please visit webinarwednesday.live for more details and complimentary registration. Thank you all again for your time today, and I hope you enjoy the rest of your day.
Thank you.